So it is important to tell your story, to align your story with the mission and vision of your facility. So it can also be the other way around. You can shape your mission and vision statement according to what you are doing. And of course, this slide could be updated with the recent discussions we just had. So you can highlight professional training. So for the users, you are training the next generation of scientists. For the imaging scientists, don't forget you are part of the story. So you can showcase unique expertise. For example, are you a skilled programmer? You developed expertise in quality management. Now for development, are you doing technology development or are you creating custom devices? This is important to know. Are you doing application development? Are you implementing new applications on the microscopes to broaden the range of users that can use a resource? Also to talk about the good user experience, we mentioned users as being major stakeholder earlier. Are you collecting feedback from the users or the PIs? And if yes, do you use it for continuous improvement or to set priorities or to define new priorities for the bioimaging platform? So now in terms of collaboration, is your facility a hub of collaboration? Are you connecting with image scientists colleagues? Are you part of an expert network? And for good laboratory practices, it is in particular important in the current reproducibility crisis, with more funders and publishers asking for more proof of reproducibility or traceability. So which ones are in place? Is it instrument calibration? Are you doing fair data management? So here are a couple of examples of vision and mission statements. So if you look, for example, at Microscopy Australia, the mission is to empower. The wording is color-coded according to the previous slide to give you an idea on which area it applies. So for Microscopy Australia, the mission is to empower Australian science and innovation by making advanced microscopes accessible to all researchers. The vision is to provide world-leading microscopes and expertise that keep Australia at the forefront of global research. So I took also another facility that is not in imaging, but I really like what they're doing too. So it's NanoFab in Mountain, Canada. So the NanoFab mission is to foster a collaborative training environment where both academic and industrial users can learn to independently produce and characterize an endless variety of devices at the nanoscale in a safe, stable, and repeatable fashion. Another one that we really like is the Latin America bioimaging that highlights community, training, resources, development with career for bioimaging scientists, and partnerships. So I'd like to do a little live poll right now to understand who has a vision and mission statement for their imaging facility. And if yes, please go into the, there's a place where you can put a little heart.
Reactions, yeah.
Reactions, thank you. I was not seeing it on my screen because I'm presenting, so. So if you go to reactions and select the heart to say if you have a mission and vision statement. Well, you have 1 minute. So for now we have 2 couple seconds. Just press once. If you press twice, it just goes away. Okay, we had 3, I know just 1, and it's gone. So I guess what the take home is, like, we don't necessarily have a mission and vision statement in our facilities. Maybe something to consider. So now we talked about aligning with your facility values. Now it's important to be able to align and understand your stakeholders' priorities. So you need to customize what you measure and how to present it. And you also need to understand your stakeholders' priority. So users will be more interested in maybe the types of applications you are doing, or the support you provide. Is that custom training, for example? Is it easy to use or not easy to use some instruments? Have a clear access policy. Sometimes users don't realize they have access to your facility. Professional skills development to demonstrate that users with imaging skill sets have better chances to in a professional environment or helps improve their future studies capability. If you look at the institution, so research quality can be demonstrated maybe with a QC policy. High-end instrument access to them is a strong student activity factor, and institutions are really interested in that. The same thing is valid for new researchers' attractivity. So having a facility leads to research acceleration. Maybe you will need to measure that. If you accelerate research, the institution is more competitive. For funders, facility as a collaboration hub. So for funders that are interested in multidisciplinary project, for example, so having a way to measure that it's multidisciplinary can be interesting. Imaging scientists that are connecting with others to demonstrate community involvement can be a strong point for funders as well. Can equity, diversity, inclusion be demonstrated within imaging platforms? Is it equal access, gender balance, minority access? For policymakers, is there an impact on society? Do you participate in curing some diseases? Impact on the economy? Are the jobs created or is it good use of public money? So especially with a highly qualified personnel, it is usually a priority in many countries. Like in Canada, they really want to see high qualified personnel trained. And maybe highlight your activities related to sustainable development goals too. But of course, it needs to be demonstrated and measured. For publishers, they can be sensitive to approaches like open science, open data, international guidelines, international standards, methods. Here is, for example, a full volume of nature methods that an international group of imaging scientists developed. So this can go up to that level if you're working together. So really, the take home here is you need to advocate for yourself, your staff, and your facility. Don't be shy, be confident. Start by grabbing attention. I know it's not easy. So here's a story from when I was in a core facility. A few years back, the core facilities in our institution were not very visible for the researchers. And we managed to be integrated at the annual researchers retreat and were able to network directly with them, but we also presented the whole scope of what platforms had to offer. This led to a better recognition and increase in users' number. Also, you need to demonstrate your value so that telling your story has an impact. And now to Claire.
So we wanted to give you a case study based on a group that Laurence and I are co-founders of in Canada. So if we want to go to the next slide, I think we mentioned this briefly last session as well. So we formed the Canadian Network of Scientific Platforms in 2016. And one of the main goals of this group is to have a voice to the funders and the policymakers, just to improve awareness of what people do in platforms. And we specifically made it general to any technology area because we wanted to have a larger voice. So we cover all the way from engineering to health sciences. And I'm sure you all have colleagues in different fields, and you know the challenges we face are very similar across all different technology platforms. And we also have some service-based platforms as well. So we thought by bringing the larger community together, we would have a bigger voice. So this was really a project that came up based on a group in Quebec called Prima Quebec that links academic researchers with companies in the material science field. And we took this idea and applied it to our community. And it was very simple, but we'll talk a bit in the breakout rooms, but I think it had a tremendous impact for a simple project. So the idea was to give platform scientist awards, and we decided to give 6 each year, and each award winner was asked to present a 10-minute talk. So we asked them to introduce themselves, introduce their facilities, talk about one success story and one challenge. And there was an award of $250, and then the video was recorded and posted on our YouTube channel. And we also had planned at the time that the winners would travel to our annual meeting, and we would cover their travel and registration and present their facility. And of course, with the pandemic, we still did this, but this was done virtually. And you'll see from the slide here that Miki Fujita from UBC, who's here at the workshop today, was one of our winners. And in the next slide, I'll just show you there's a link if you want to see her video. And a couple of things that came out of this, the supervisor had to write a letter of support, and oftentimes the scientific director of the platform is not so engaged, and they're kind of busy with their own research programs and involved in the facility as much as they can, but are not really involved in the day-to-day operations. So it was a really good opportunity for the imaging scientists to go to their facility director and make them more aware of exactly what they're doing and get a letter of support. So that was kind of one interesting aspect. And the other one was once the awards were announced, we actually had universities contacting us saying, we didn't hear about this. How come we weren't made aware of this award? And so, normally we're chasing the institutions to try to raise awareness. And in this case, they were coming back to us to find out more information. So that was really interesting. And it was a fairly low administrative load. We actually, last year, we got the winners. We've run it twice. So last year, we asked the winners from the year before to be judges of the applications in the new pool. So we've had 12 of these so far. And we also gave out a Platform Administrator Award last year to recognize people. There's a lot of people now who are overseeing all of the infrastructure platforms in their whole institution. So the link is here if you want to watch Miki's video. And we'll go on to the next slide. And we also wanted to highlight this video from Queen's University in Kingston, Ontario, where they were doing a walkthrough of their cardiopulmonary unit, which involves many different platforms. And we're going to watch a little bit of this video, about 7 or 8 minutes, and then we'll discuss the Platform Scientist Awards and the video in our next breakout session.
So my name is Dr. Charlie Highmarch, and I'm a genomics researcher at the Queen's Cardiopulmonary Unit, or QCPU. QCPU provides state-of-the-art research infrastructure and expertise to the Queen's community. Founded by Dr. Stephen Archer, a MEDS 81 graduate, QCPU provides 8,000 square foot of research infrastructure to the Queen's community, which offers a bench-to-bedside translational research approach. QCPU is located in the heart of Queen's campus, next door to the medical school and opposite Summer Hill. So at QCPU, we primarily focus on heart, lung, blood and vascular research. But we also provide research infrastructure across the university. So if you're a cancer researcher or if you're in bioengineering, we probably have some of the tools to help you achieve your research ambitions. In 2020, we helped 3 faculties, 16 departments and 27 research groups. And since 2019, we've trained 73 scientists. So QCPU has 2 main arms of research, the first being clinical research. But the basic scientific research is split between 5 research laboratories who are staffed by 5 highly qualified scientists who have been recruited from around the world. So today, I will take you on a journey from populations to cells to genetics. And I'm going to introduce you to the scientists who are going to tell you about the infrastructure that they have in their laboratories and how they address the vital challenges we face today. QCPU is a translational research facility, which means it's particularly important that we have access to a clinic. And what this does is actually this takes patients from the Kingston community and offers echocardiography services for part of their normal clinical care. One advantage to having sonographers and registrars and medical staff on site is that we can also use these facilities in order to be able to facilitate active research projects and translate the findings in the laboratory back into the clinic and back to the bedside. So the first lab we're going to go to today is our histology lab, and I'd like to introduce you to Oliver Jones, who is a clinical histologist who is trained in the United Kingdom as well.
Hi, I'm Oliver Jones. I'm the histologist here in the QCPU. So I run the histology service. So what is histology actually? The histology is simply the study of tissue. So what that means is we take tissue from either clinical samples or from research samples, and then we process them so we can look at them down the microscope to see at the cellular level what's going on with the tissue. Now, as you can imagine, if you took a piece of tissue and tried to cut it to put on a microscope, it's going to move around quite a lot. So to do that, we have to process it into a hard medium, which we use wax, so we can cut the sections to put on the microscope slide. So here is our tissue processor. Now this processor will take the tissue, which comes to us in a fixative to preserve the tissue and to kill any bacteria or viruses. And it takes it from the fixed state into a state where we can put it into wax.
So we're not going to show you the whole video. I invite you to go there and you will meet the other facilities. So now we can move on to the next breakout rooms and discuss two things. First, based on the scientific platform Scientist Award, how did this project impact stakeholders, whether it's users, departments, institutions, funders, or publishers? And the second question would be based on the platform Scientist video based on the QCPU video. You saw a bit of that. Did they succeed in showcasing their vision? And what might have been missing? Professional development, technology development, good user experience, collaboration, and good laboratory practice.